As you already know, our brain is extremely important for everything we do. Consequently, the brain and spinal cord are the most protected organs in the body. In this module, we will learn about the different layers of protection that exist for the brain. In this picture, you can appreciate the different layers of protection that exist for our brain. You can see that in the outer part, we would start off with what is not necessarily pointed, which is our skin. This right here is filled with nerve endings that let us know when there is pressure or a hit, and it will allow for our body to move so that we could reduce the impact for that. Should it not be enough, then we go on to a thick layer of skull that is quite tough, especially as we get older. The younger we are, the skull is not fully fused, and we know that we have fontanelles, which are these gaps that exist in there, and they're not fully fused until adolescence. But this also serves as a physical protection. And then thereafter, we start getting into the more interesting parts in here, and these are the three meninges. Meninges is Greek for cell membrane, and we find that there are three basic membranes in here. We have the dura mater, and that is basically what is the toughest outer membrane of the three. And then we have the arachnoid membrane, and that is what looks like a spider. You could see like a spider web-like thing in here, and that's where it gets its name from. And then we have the pia mater, which is what's really adhering to the brain and the surface. Please note that although the picture is only demonstrating a brain in this case, we would have the same meninges protecting the spinal cord as well. Please note that although these meninges are considered separate, they both serve a purpose of keeping the brain and spine in place. Flowing through the subarachnoid space, which is what you see here in the spider web-like thing in here, flows cerebrospinal fluid. And this also serves as a protection, as it functions as a cushion to keep the brain intact should there be some type of movement or head trauma. We can also find cerebrospinal fluid at the central canal of the spinal cord and the cerebral ventricles of the brain, which we will see later. Although the process through which cerebrospinal fluid is produced is poorly understood, it is believed to be produced by these networks of capillaries or small blood vessels that protrude into the ventricles from the pia mater. Again, the ventricles we'll be talking about are basically these cavities in the brain, and there are 4 large internal chambers in the brain that we will discuss later. Patients who have had some of their cerebrospinal fluid drained away often suffer from terrible headaches and experience stabbing pain each time they jerk their heads. Having a good amount of CSF, cerebrospinal fluid, is essential for. In this picture, we can appreciate the cerebral ventricles, which, as stated earlier, are this hollow part or cavity in the brain. There are 4 large internal chambers of the brain. We have 2 lateral, 1/3 ventricle, and the 4th ventricle. Here in this picture, you can appreciate the lateral ventricles in this view. You can also appreciate them right here, the lateral ventricles. You can see the 3rd ventricle, which is right here. Difficult to see it a little bit more so, but wider view here. And then the 4th ventricle would be toward the hindbrain, approaching the bottom. Here is a view from the top. Again, these are interconnected fluid-filled spaces that are extensions of the spinal cord. The function is to provide some cushioning against brain damage, and they're also used as landmarks for determining the location of other brain structures. Oftentimes, these are used by neurosurgeons to determine the distance as to where a tumor may be located, and they may use these as a pinpoint, to measure how far to the right or inside they would have to make the cut. In addition to the physical protection, the brain also needs to be protected from chemical attacks. The blood-brain barrier, or the BBB, is the primary blockage of passage for many toxic substances from the blood into the brain. The brain is a finely tuned electrochemical organ whose function can be severely disturbed by the introduction of certain kinds of chemicals. The blood-brain barrier has a two-level security system, one which is made up of tightly packed endothelial cells to block the entry of many molecules, and then secondly, special pumps that are made out of protein and to pump any molecules that may have infiltrated back into the vascular system. The blood-brain barrier is basically made up of tightly packed cells of the cerebral blood vessel walls that prevent entry of many molecules, particularly proteins and other large molecules from the blood into the brain. In the rest of the body, the cells that compose the walls of the blood vessels are loosely packed, and as a result, most molecules pass easily through them into surrounding tissue. The degree to which drugs, therapeutic or recreational, although recreational is a bit vague, so let's just say therapeutic or not, can influence brain activity depends on the ease with which they penetrate the blood-brain barrier. The blood-brain barrier does not block or impede the passage of all large molecules. Some large molecules that are critical for normal brain function, such as glucose, are actively transported through cerebral blood vessel walls. You may get the idea that the blood-brain barrier is somewhat like a bouncer at a club that determines what comes in and what does not. Please note that while it serves a great purpose, it works well with healthy individuals, but if there were to be a need to deliver medicine to the brain, this can also present a challenge, as the medicine could be rejected by the blood-brain barrier, not allowing for this medicine to take care of the infection, if any, in the brain. For clarification purposes, earlier that I referred to endothelial cells, I was referring to endothelium, ENDOTHELIAL, which are basically cells that line the interior surface of blood vessels. These form an interface between the circulating blood and the rest of the vessel wall. The functions that they serve, and there are various, but in this particular case, it's a barrier function, where it acts as a semi-selective barrier between the vessel and surrounding tissue that controls the passage of materials and the transit of white blood cells into and out of the bloodstream. In this specific case, we're referring to the brain.